Hi everyone, this is just a short video to talk you through perhaps how to tackle some of the answers in these Moodle quizzes that are essentially the platform for the final exam. So I'm in like a mock quiz already, it's just a demonstration one, so the content may not be fully aligned with the current paper you're doing. So I'm looking at the first question. This is just a straight out recall question. So a size 4 LMA should be inflated with what volume of air? And from memory it's 30 mils of air. So I just click the 30 mils from all those selections and I move on, and I can see that's marked out of 1. The second question is a scenario question marked out of 2, so I get a bit more for answering this. It's worth spending more time on it. So you attend a 50-year-old male who has collapsed on a busy central city street during morning rush hour. He's unconscious and unresponsive and has gasping respirations, approximately 1 every 10 seconds. So that's only 6 a minute. The 4 most important initial actions at this stage are, well, to me he sounds like he's in cardiac arrest: unconscious, unresponsive, no breathing apart from gasping respirations, so that's a definition of cardiac arrest. Therefore, let me see, my first thing is begin assisted ventilations at a rate of between 12 and 16. Yeah, that sounds like sensible. Opening his airway using the head tilt chin lift maneuver, that sounds sensible. Call for ICP assistance for intubation, not initially, like it's not one of my 4 most important initial items. Call for RSI assistance for drug assisted intubation, no, not initially. Consider reversible causes, the 4 H's and 4 T's, again not immediately. Insert an LMA, not straight away. I mean, that would be a really good thing to do, but we've got important other things to do immediately, and we do have an airway with our manual maneuvers, so not yet. Attaching the defibrillator and delivering a rapid shock. If it's a shockable rhythm, absolutely. So that's 1. Administer amiodarone, no. Begin chest compressions, absolutely. Good basic cardiac arrest management. Administer 1 milligram of adrenaline, not initially. Insert in a peripheral IV, not initially. So I've got 1, 2, 3, 4, and I'm happy with those selections. So I just will continue to the next question. So this is just a mix and match question. So match the colours of the triage tags with the corresponding status of the patient. Now actually this is where things like the guidelines will help me. So I can click to, I've got the St John Comprehensives open here, and looking down through I know that somewhere or other there is information on mass casualty incidents, and I'm just having a bit of trouble finding it. So this is where being really familiar with your guidelines is very important, and I just wonder if their layout is slightly different. So let me see. Right, the status code. So I know that the information I'm looking after is under status codes. So I'm going to click to the status codes, and it shows me that status 0 is dead, and that is a black or white triage tag. That status 1 is red, status 2 is orange, yellow, status 3 and 4 are both green. So that information, as long as I'm familiar with the guidelines, is readily available to me. So I'll click back to my quiz, and red, we decided that was status 1, black, white, status 0, yellow, orange, status 2, and green tag is status 3 and status 4. Right, so the next question, which is out of 1, the physiological indicator of shock that will change earliest in the process is pulse pressure. No, not earliest, I don't think. Blood pressure, no, everything will be maintained. Everything else will change to maintain a good blood pressure. Cap refill time will change eventually. SpO2, now you can have pretty good SpO2 even if you're short on blood. The remaining blood can be well saturated. pulse rate. So I reckon the pulse rate is the answer I'm after. So I'll click that and move on to next. So now we have two scenarios here. So you attend a 65-year-old male patient who has passed frank blood in his stool this morning. He's pale, clammy with cool skin peripherally. He complains of feeling faint when he is sitting or standing. His vitals are weak radial pulse at 120 a minute. Blood pressure is 109 on 94, sorry, 108 on 94. SpO2 is 96, rest rate 22, cap refill is 3 seconds, temp 35.8, so he's slightly cold. BGL 9.3. The three most important actions are, so to me, he sounds shocked. It's pretty clear that he's been losing some blood from a GI bleed and that he is exhibiting signs of shock. So I'll be looking for, let's just go for the basic stuff to begin with. I'll come back to the fluid. So oxygen therapy, well, his SATs are 96. So I'm less concerned about that right off the bat. But positioning him flat, I would like to do that. I'd position him with his legs elevated. What else have we got? Another oxygen therapy one. And the rest are all options for fluid therapy. So the first one, administer up to a litre of normal saline, titrating to perfusion, considering heart rate, pulse strength, cap refill, pulse pressure, blood pressure, and LOC. Right, that sounds like the one to me. So I'm going to click that. Let's just see what the other options are. Administer up to 1 litre of normal saline, aiming to maintain a blood pressure of 120 systolic. Right, well, I know what that is. That's for traumatic brain injury, not for a GI bleed. Next fluid therapy one, 1 to 2 litres of fluid minimum. If still no improvement, call for ICP assistance for an adrenaline infusion. Right, well, that is for septic shock, so not for GI bleed. And lastly, withhold fluid unless the patient is severely shocked, i.e. has no radial pulse, an unrecordable BP, or a falling LOC. Right, so I know that fluid guideline is for uncontrolled hemorrhage, so that's not the one I'm going for. If I want to double check this, I could flick back to the guidelines quickly. I'll go back to the menu. Oops. Or the index, and I am after hypovolemia from other causes. I'm pretty sure that's the one I want. So I scroll down, blunt trauma, peripheral blood loss that's been fully controlled, gastrointestinal bleeding. Right, so that's hypovolemia from other causes, so that's the one I want. And yes, this one is give 1 litre, aiming for an improvement in perfusion. So that's definitely the one I'm after. Okay, next we've got question 6 is you attend a scuba diver who's been brought to shore after an hour-long dive to 70 metres. He's doubled over in pain, responding to voice but withdrawn, his eyes are closed unless you speak to him, complains of severe joint pain, particularly in his elbows and knees, and that has caused him to curl into a ball. He has pale, cool skin, which is dry, vitals are pulse weak at 105, blood pressure 115 on 80, cap refill 3 seconds, so it's prolonged, rest rate 24, so it's elevated, SpO2 is 96, BGL 6.3, temp 36.2, and he's in a sinus tachy. So the 3 most important actions are, well, once again, I'm reasonably confident on this one, but once again I'm just going to flick back to the guidelines, go back to the menu, look for, and this is where you have to know your guidelines really well. So here we go, under miscellaneous, there's scuba diving emergencies, and it says the first 3 things: position patient flat, administer oxygen at high flow via reservoir mask, gain IV access and administer sodium chloride using the hypovolemia from other causes section. Okay, well I know which one that is. So let's go back to the quiz. So I'm going to select oxygen therapy, fluid therapy, up to 1 litre, titrating to perfusion, considering heart rate, pulse strength, cap refill, pulse pressure, blood pressure, and LOC. Yep, so that's the guideline I'm after. My patient flat. Sit up, no. Pain relief, no. And so there are my three options. So this question here is identify the following ECG pattern. So really I need my ruler ideally to check here, but I'm just going to work through my systematic way of checking for ST elevation and T wave inversion. So lead 1, there's a tiny bit of ST depression and probably a biphasic T wave. Lead 2, maybe a mil of ST elevation. Lead 3, maybe a mil of ST elevation or 2. AVF, there's a mil or 2 there, so I'm already looking at an inferior MI. Checking the sister lead to lead 1, which is AVL. I've got a couple of mils of ST depression there. Then V1 has a mil or so of elevation, V2 is baseline, V3 is baseline. So is V4, V5 and V6. Okay, so inferior infarct is my diagnosis. And I'll scroll down until I find inferior MI, and that's the one I'll select. And that is me done.